what we would like to do with Satori is to develop these soft, deformable, biocompatible structures, instruments, and also implants that would truly make surgery less invasive, better for the patient, and also more accurate.
Try to create an injectable stent that is able to move to the location, fold itself, attach to the tissue, and also be useful for imaging and also for release of molecules.
The clinical impact, I think, is huge. It's really a step forward to really minimally invasive, what it really means. So injectable materials are, I think, the next step, the next level. We can treat a lot of patients in that way.
We'll do this HTRIC research together with my partner, Jelmer Prins. So we want to achieve that we have a reliable pre-diagnostic test for preeclampsia. There is no early detection possible yet. We only have late diagnosis, which is mainly high blood pressure and changed T-cell populations, but it's very late. However, we know from research that T-cell populations already start to change earlier on. However, this is very hard to grasp, and this is exactly what this project will focus on. After completing this research, we want to have a pre-diagnostic test that's reliable and that will show if women are at risk of developing preeclampsia, so we can give them earlier treatment.
Well, the main goal is to help diabetes patients to better cope with their disease by giving them personalized feedback based on all kinds of personalized data that we can gather by means of wearable technologies.
Personalized feedback is at the moment lacking. If someone fills in a diary in a book and he lies to himself, well, then that's what is in the book. And by using wearables, we want to support this therapy and also give people something that they can continue after the therapy stops.
We'll be able to manage their disease for a longer period of time with more success. And that will also have a big impact on society as a whole, because diabetes is a very common disease with a lot of financial costs and also personal costs.
Intestinal fibrosis is the end process of an inflammatory process which may take years. Usually these patients are diagnosed at an early age and they need treatment and monitoring for the rest of our lives. And we can help them by introducing new concepts for monitoring and treatment of the disease, which improves the quality of life for the patients. Our goal is to develop new nanomedicines that selectively accumulate in the target cells. These target cells are the cause of the disease, and by monitoring this disease activity, we hope to be able to use these nanomedicines, these innovative nanomedicines, to treat these patients and, more important, to have an early diagnosis for this disease.
We hope to achieve that we get a tangible implant produced with our composite and that we can make an actual product on a large scale.
The state of the art is that there are degradable plates and screws available to fix fractures of the broken mandible. However, they're not strong enough for really load-bearing areas, so we need stronger plates.
Yeah, also directly to the patient is that we create a better implant that sustains the recovery of the patient, the healing of bone fractures.
Our idea is also to have biomaterials that are abundant on Earth and fully sustainable. So that's also something that we bring into the game.
We are very pleased with the opportunity that HTRIC provides us the chance to explore this together with Polivation and Consumer Chemicals. So I think the program really brings together the preclinical, clinical and industry, and hopefully this will lead to what HTRIC aspires to better health for patients and the introduction of new medtech.